Hello and welcome to Infinx's Office Hours. I'm David Bird and I want to thank the audience for joining us today, as well as Jaideep Tandon, Infinx's co-founder and CEO. I have quite a few questions that we're going to cover on our topic today: optimize practice acquisitions with data-driven revenue cycle assessments. It's a lot to say. And time permitting, we'll open the floor to the audience at the end of the session to address any questions that you may have. If we don't get to your question, we'll be sure to follow up via email to get you the answer. So JD, before we dive in, it'd probably be beneficial for those attendees that may not be familiar with Infinx, if you could just give an overview of why you founded the company and what Infinx's mission is.
Yeah, well, David, happy to be here. We started these office hours about 2 years ago almost now, and it's been a great time. I know you've participated in a whole lot of them, more than me, so I'm excited to be back on here having this conversation about a topic that's really interesting and I think timely in the market today. So yeah, just a little background. We embarked on this journey of Infinx about 10 years ago. The early days, we were supporting our healthcare provider customers in a broad set of business services. Very quickly, we started to realize the significant revenue leakage all our customers experienced in their revenue cycle operation. And that's kind of when we made it our mission to serve as a partner to our healthcare provider customers in not only reducing the RCM operational cost, but minimizing and hopefully eliminating revenue leakage that they were consistently seeing. So today, our solutions and services are designed with that singular purpose. How can we make our provider partners more efficient in that core mission of serving patient needs without them having to spend effort on revenue cycle operations? Fast forward to today, we have over 300 healthcare provider organizations we count as partners who've guided us along this journey, and over 5,000 amazingly talented team members focused on our mission. It's been extremely gratifying and humbling, and we couldn't be more excited about the future.
That's awesome. I know just being here for 4.5 years, to see how the company's changed in that amount of time, I can't imagine what you feel over a decade, seeing how the company's grown. So let's dive in a little bit to the topic at hand in the practice acquisitions, and just to provide a little bit of insight to the audience. According to the American Antitrust Institute, there were close to 485 physician practice acquisitions by private equity firms. That doesn't include the physician acquisitions, only private equity. And so when you compare that, it was a 12% increase from the number of acquisitions in 2021. And if you look at where they targeted those specialties, there's 4 that they targeted, and we'll do it by rank. First was dermatology, second was ophthalmology, third was gastroenterology, and finally last was primary care. And the primary indicators for those acquisitions was due to an aging U.S. population, consolidation within healthcare, and then the desire for those physician groups to take on private equity capital so they could expand and grow. And then lastly, it was some of the physicians just wanted to cash out for retirement. So JD, from a high level, can you briefly touch on how Infinx supports a physician acquisition thesis?
Yeah, so I mean, I think the stats you put out there, for one, I think we see it in our overall customer base today, right? Some of those specialties you mentioned, we see a lot of activity around those in terms of our customers bulking up and getting bigger in and expanding geography, as well as some of them getting acquired by larger roll-up groups. So as you know, our core business is focused on all aspects of revenue cycle operations in a healthcare provider organization. I'd like to say, simply put, we follow the money, right? Over the years, as consolidation among healthcare providers has picked up pace, we have had the opportunity to work along some of these target organizations as well as acquirers to help support that investment thesis. Our solutions enable our customers to gain unique insights into the health of their revenue cycle operations. It's almost like most of revenue cycle tends to sit on the balance sheet, and then when it really comes time, we got to make sure it hits the P&L, right? It's like converting to cash. That's really what revenue cycle becomes is all about. So those insights into revenue cycle operations are what's needed to better understand where there may be opportunities for folks to improve cash collections, reduce denials, shorten days in AR, which typically are pretty basic metrics for any other business, but the nuanced nature of healthcare with the claim volumes, with the payer mix can get relatively complex. So our goal is always to provide insights towards some of those things. And these insights can be critical in any valuation discussions, as well as any post-acquisition transition planning that the companies may be considering.
So you and I have had, a lot of experiences in acquisitions, and in those activities, once you get into the data room, the quality data is key in assessing an acquisition target. And really, RCM data is the backbone or the lifeblood of a physician practice. From your perspective, what are some of the key data sets within RCM that really should be reviewed when you're looking to acquire a practice, and why are those data sets so important?
Yeah, David, you couldn't have framed it any better, right? RCM data is the lifeblood of a physician practice, and it can be quite a maze in those data rooms, trying to figure out and tease out what all that RCM data looks like. So the data set in RCM, as we know, can be broad, and it's easy to go down significant rabbit holes. We see that all day long with a lot of our customers, right? They find one thing and then they want us to chase that, and it's always about recalibrating and looking at the bigger picture. What we like to do is set some key metrics that are universal across all practice groups, and then define other KPIs that may be uniquely suited to that type of practice, dependent on perhaps the specialty they operate in, the geography, payer mix, and patient population, or other aspects. Universally, we should, of course, always look at gross collection rates, DSO, and compare that to industry benchmarks. I think that's important to kind of give just a easy baseline, but also critical to review and manage is the AR, especially I like to always look at the greater than 90-day AR. That's a very telling sign. If that's been sitting there and rotting, there's probably something going on that needs to be addressed. Charge lag is another one. I mean, it helps. There's no reason why practices should see any type of charge lag. If charges are coming in, they should be billed out pretty quickly within 24, no more than 48 hours. It pushes the physicians as well and ensures that they get their charges in a timely manner. So RCM operations can always stay on top of it. And then denials. What are the top denials, and are there some issues that might be leading to those denials? As practices get bigger, these problems or these data sets can compound themselves into things that are potentially could be landmines, right? And our job is to go through this data set and highlight some of those hotspots. We also like to do compare the reimbursements against the contracted fee schedules. I think that's a critical metric to look at. Very often, we find customers, I get my claims get billed at exactly what I bill out at, but are they really comparing it against Medicare allowable, against fee schedule? So that's another thing that we like to look at. And all of these, reviewing them help then drive action. So we recommend to all our provider partners, as well as financial partners who may be acquirers, that having an in-depth review of the RCM data is critical to understanding the true cash flow of the business that they're evaluating at that point in time.
I think you nailed it by saying this data, it's so massive that it can take you down a rabbit hole, and some of the private equity firms out there that we've been exposed to don't really have those SMEs that truly understand RCM data. They're great with financial data, right? That's what they do. But when it comes to understanding the RCM data, it can get very arduous, and it's a very, very manual review for the most part. Infinx has a ton of experience with RCM data and has been able to leverage and assist in review of practices health, like you just mentioned, both pre and post acquisition. What are some of the background, or what's some of the background that you can give description to on why Infinx developed the solutions that we have and the benefits of those solutions when it comes to processing these large RCM data sets that you just mentioned?
Yeah. So in the by the way, as an aside, I always joke with CFOs that I really respect the CFOs that recognize they're not SMEs for RCM and bring in the right leadership to support them there, because it is two fundamentally different functions. It may be finance, but it's a very nuanced finance that a specialist always helps in that role. So just addressing your point around the pre and post acquisition. So in the early days, we noticed sort of the set of challenges our provider customer faced were, for the most part, very similar. Most did not have access to data on their RCM operations, and without data, they were operating blind. It was a constant battle of changing priorities, having staff members focus on various starts and tasks and projects which had no start, no finish, or goal defined. So as we grew our business, we took a very data-driven approach towards our solutions, because obviously we were answerable to our customers and we wanted to be successful in our engagements. And the best way to do that would be to have a data-first approach, do an assessment, and from there define the key metric baseline, and then define key metrics for success. So today, nearly all our engagements start off with our RCM Health Check. We try to keep the initial assessment light so that it's not too intrusive for our provider customers, but at the same time, help in setting those baselines I was mentioning, and those lend themselves to developing a high-level action plan. From this, we can deploy our RCM solution, improvement solutions and performance improvements across the organization, and have a constant ability to monitor that performance and course correct as needed. Because one thing we realize, there's no one size fits all here. You can't upfront define what you want to deploy and just say that's all I'm going to do. It's a constant iterative approach that you have to take. So data-driven actions are now core to what we do for our customers. And the additional benefit of the data insights is a more efficient manner to implement improvement plans in every aspect of the RCM operations that can lead to that revenue lift that all our customers desire, right? So we usually see an improvement in cash collections anywhere between 12 to 25% within 90 days of starting to deploy our approach. And for most practice groups, that's a significant and impactful number towards bolstering any acquisition thesis, right? Be it for an acquirer or a target. It's meaningful numbers we're talking about.
So essentially what you just said is you can take all this data and then Infinx can turn that around in a pretty quick manner and provide an overall health of that practice. Is that correct?
Yes, absolutely. So you and I have both been involved in a lot of our more recent engagements, right? Like where of late we have started working with financial backers who are consolidating physician groups in a particular specialty, or perhaps working with advisory firms that are working with these financial firms. Recently, we deployed our RCM Health Check as a due diligence tool for a few of these organizations. And it's, like I said, it's light. In a short span of roughly 2 weeks from getting access to their data after executing the appropriate BAAs, we can provide in-depth data insights and analysis and identify areas of improvement. And the RCM Health Check brings, what it does is, as we started doing more and more of these, is brings a level of consistency and across all the targets being evaluated. So we can actually do compare and contrast with respect to payer mixes, geographies, and perhaps other local aspects that might be unique to that practice that might not be evident when you're looking at the financials.
Yeah, so essentially what it sounds like, I mean, having been in data rooms, right, where you have folders filled of different data types, what we've done essentially through some of our offerings is we've created a digital data room that automatically calculates and provides models for the private equity people or the practice administrators for that matter, so they can get a quick snapshot and to see the health of that practice or where that practice could need some improvement, so to speak.
Yeah, exactly, right? It's like there might be AR on the balance sheet, but what is the true AR that they should actually account for? And that's a question that comes up often in these types of engagements, that is it really true AR, given the high denial rates, the low collectability of some of the AR that's been sitting there for a while.
Right. So I think one of the, and I think it's probably one of the most underestimated components of an acquisition, but in my mind, it's one of the hardest, is when you go to integrate that acquired company, right? You're merging two different cultures. Sometimes there's different systems, different processes and methodologies that are being used to try to get to the same end goal. How does Infinix assist when it comes to the integration through an acquisition?
Yes, and again, going back to having the more recent work we've done, we're getting more and more exposure to this thing. And one aspect that I've started to recognize is integration in healthcare provider groups is very, very different than corporate mergers, where you can have a tried and tested playbook for integration and day one post-close come in and start working that and just go down the checklist. There are way many nuances, as you mentioned earlier, around patient demographics, around payer mixes, the geography, and the culture of that unique organization that's usually physician-led, right? So very often we see when acquisitions and roll-ups are happening that there is an urgency to bring in standardization across RCM operations. That's kind of the view we get, right? We, from our perspective, we usually lay out a phased approach for our customers for acquisition integration. They have to be cautious with regards to deploying new technologies. I think that there is a tendency to say, oh, I'm going to standardize with one technology platform. But what we've seen time and again is these deployments can be disruptive to the organization and can have an immediate and pretty negative cash impact, which then in turn leads to some significant dissatisfaction again amongst the target organization that's been acquired, the physician leaders of that organization. So our plan usually focuses on broad RCM assessments, providing the key metrics and the needed data to have a consolidated view of the practice roll-ups, right? As a financial backer who's trying to roll up practices, they obviously want that level of data reporting. So what we try to bring in is let's focus on getting them what they need for their data needs, but then looking at each practice individually and crafting a plan to assess the revenue operations and provide recommendations for some of them. And very often we see certain practices where we do our assessments, they're operating very efficiently, and there is best practices they've implemented that could really benefit the rest of the organization, and other practices that perhaps have not implemented those. So we pick up those, and those are some of our recommendations. Then we try to bring in a level of consistency across the organization, and our recommendations can include sort of identifying those hotspots, include deployment of a solution, or simply recommends simple tweaks in the business process that can yield pretty significant results.
Right. I remember one of the private equity firms that Infinix assisted with in acquiring a physician group, which that physician group was losing money due to high denial rates. It's easy to identify denial rates, right? But by analyzing that group's RCM data, we identified the specific reasons for the denials, and then we helped develop a strategy to address those denials. And as a result, the denial rate dropped by something like 25%, and obviously the group's profitability improved significantly. How does Infinx, or maybe you could go expand a little bit more on how Infinx's technology assists in denial trends and monitoring overall payer behavior? I know that there's a lot of artificial intelligence, machine learning, and other technologies that we leverage, but can you kind of expand on the denial trends and the payer behavior, how we monitor on that?
Yeah. I do remember that example you brought up, and that was a pleasant surprise for them, right? I mean, they hadn't modeled the additional cash, and so that was definitely, that helped out a lot. But yeah, the first aspect to our technology, again, starts off at that data insights level and identifying the hotspots. Is it a denial problem? Is it a problem perhaps related to charge lag or AR follow-up or something else perhaps that's going on in the practice? Once we have a better sense of this, we're able to focus our efforts firstly on the low-hanging fruit, right? What can we go in there and make impact in the 30, 60, 90-day time frame? Our approach is to deploy quick and show results and then build on that success. For instance, very often we AR operations across the board are understaffed and not optimally deployed in our customer organizations. So our AR solution is focused on prioritization and turning AR into cash in the shortest amount of time with the least amount of staff, while ensuring we don't lose any AR to timely filing limits. How we do that is through our proprietary AI machine learning approach, which can look at historical data, payer data, and prioritize based on what's likely to pay the quickest and at the highest reimbursement level, so that you can have the least amount of people working your AR, but getting the most bang for your buck. Similarly, looking at denial trends, we can deploy insurance verification solutions if that's perhaps an area that needs assistance. Very often we see the need of deploying an insurance discovery solution. There's patients that have been seen, care has been rendered. However, insurance wasn't captured as at point of care, and the insurance discovery can actually find coverage, and the practice group can bill it out. And then there's obviously our industry-leading prior authorization automation that we've deployed in many practices. We probably process over 300,000 transactions a month now around prior authorization. So at the end of the day, the approach is to focus on the key areas where we can deliver value in the shortest period of time. Recently, I was speaking with a CFO of a large practice group in the ambulatory space, and we deployed our patient access solution, right? And we were very much focused on deploying and scaling that solution. And one of the insights he provided me, and actually we hadn't looked at the data yet, was that within 60 days of deploying our solution, he saw a immediate dip in denials that were related to insurance verification and authorizations. And so he's like, I feel comfortable going into the next budget year to actually commit to a 25% denial reduction target that we as a team can work towards, because we know we have line of sight to be able to achieve that. So all of these sort of help them then refocus staff away from chasing denials and focus really more on care-related activities, their core business.
And that's what it's all about at the end of the day, is patient care. And I think a lot of physicians and maybe back office administrators forget that, you know, once that patient walks out the door and the care's been given, then the bill comes.
Yep.
And that's patient care too, right? You got to take care of that patient even when it comes to the financial. But let's unpack that a little bit more on Infinx's capabilities, because I would say, you know, from a market perspective, maybe that, the market sees us as a prior auth vendor, and we're a leading vendor in that space. We talked a lot about RCM data, but the way that I look at Infinx is we make sure that patient gets in the door for that patient care that you just mentioned, and then we take care of the code, the bill to collect as well. So what are some of the ways in the billing practices that our technology helps with the private equity groups when it comes to positively impacting AR days and that overall time to collect?
Yeah. And by the way, you're absolutely right? A lot of the patient dissatisfaction in today's healthcare system is not related to the care that's rendered, but about the billing, about the bills they receive, about the surprises, and streamlining that, I think, is a key component of improving our healthcare system. But like I was just mentioning, I think all of this, how we approach it is it starts off with that assessment, the RCM assessment. This gives us the insight on where attention is needed. And having done this for as long as we have, patterns start to emerge. One of them being insurance eligibility denials, prior auth denials. These two almost always, in every assessment we do, I'd say 95% of the time are among the top 5 denial categories we see. So these are almost always our focus, and it's become sort of the fastest growing segment, as you know, of our business is around our patient access suite. More providers are recognizing that front office RCM ops need the same attention and need to work in sync with back office RCM. Our patient suite is designed to preserve revenue through that entire life cycle, ensuring that the patient is financially clear, co-pays and deductibles are readily available so that you can try to collect them at point of care. And if an authorization is needed, it's on file before the patient shows up. Insurance discovery can also be deployed to find perhaps coverage that the patient themselves may not have provided to the organization at that point in time. So all of these sort of working together, what we've seen lead to happier patients, less rescheduled appointments, and reduced denials, improving cash flow.
We're coming up on time, so I just want to remind the audience, if you have any questions, to go ahead and key those questions in, and we'll get them addressed. We do have a question here. It says, I know a lot of practices have cutting-edge clinical devices for patient care, but interesting enough, they tend to keep older technology or software to manage the back office. And as healthcare moves into a more consumer-driven market, like we just mentioned, patient satisfaction becomes more important. Are there any data points that you can provide on how private equity or acquiring physician groups assess practices, technologies for acquisition, and how Infinx helps to identify those?
Yeah, so and that is, I think that's a great question. It's correct that you might have the cutting edge care equipment in a new CT or an MRI, but they may still be operating on a outdated, archaic, not necessarily interoperable EMR system. And a lot of that we see is sort of over time, just the fact that how critical RCM operations are for an organization, ripping out technology and adding something new is just very disruptive, and it's very often leads to dissatisfied physicians as well as the staff members around it. So it's a fine balance here in terms of as you deploy new technology. So our approach, right, is really working agnostically compared to these relative to these EMRs, build the right integrations, and then provide a holistic cloud-based approach to our customers that perhaps there's a diverse set of EMRs being used across all their practices that they've rolled up, but our system can sit at the top as a cloud system that integrates with all the key payers, clearinghouses, EMRs, to ensure the data flow is clean and the correct set of data is presented to the right folks. And at the same time, we try to get into the transaction processing aspect of it, right? Some of these EMRs are amazing books of records where the patient financial information sits secure. However, not all of them are designed for processing high volumes of data. And so we've, again, developed solutions to enable client teams and our teams to more efficiently process information, be it a transaction around insurance verification, around prior authorization, or something around AR follow-up, or working a denial. All of those sort of cohesively working together and in sync with what the EMR data looks like.
So Jaideep, we're at the bottom of the hour, and I want to be cognizant of that for the audience. But as we conclude this office hour session, do you have any last thoughts, maybe something that we didn't address that you'd like to share with the audience, and Infinix's role in supporting acquisitions pre and post?
Yeah, no, I think firstly, I really enjoyed this conversation. I didn't even realize the 30 minutes is up. So I think what I see from an industry standpoint, this is an exciting time in healthcare. When I'm talking, I mean, it's a massive component of our U.S. economy. I think it's 23% of GDP. So it's really fun to be part of it, and it is finally we're seeing a time where technology adoption is picking up pace, and I think it's a matter of figuring out how to go deploy some of these solutions without being disruptive to the organizations, and getting them all of these tools that are necessary to operate their businesses. So it's a fun time to be able to see sort of the business world and the physician leaders coming together, and keeping the patient front and center in this healthcare journey. So we're like I said, super excited, and we continue to help a lot of these physician groups as well as the roll-up organizations sort of be that go-between in providing them the insights they need to better first evaluate this business and then obviously operate them for the long term.
Great, I agree with you. Time flies when you're having fun. This was a good conversation, and hopefully we'll have you back soon. So thanks again for joining us.
Had a great time.
And thanks to the audience. Thank you.
Thanks to everybody, and thanks, David. Appreciate it.